The relationship between infertility and amenorrhea. What does amenorrhea mean? It means the absence of menstruation. It is divided into two types. One is primary amenorrhea, and the other is secondary amenorrhea. Primary amenorrhea refers to never having had a menstrual period. Most cases are caused by congenital conditions. Secondary amenorrhea refers to the absence of menstruation after a period of normal menstruation. Amenorrhea can affect pregnancy because menstruation is an indication of ovulation. Without ovulation, there are no reproductive cells, which certainly prevents pregnancy. Treatment must be based on a clear diagnosis. There are no specific drugs. Claims that certain drugs can cure amenorrhea are unreliable. There are no drugs specifically for treating amenorrhea. Only after a clear diagnosis. Can effective treatment be achieved through different measures and medications based on the underlying cause? First category, primary amenorrhea. Primary amenorrhea is mainly characterized by never having had a menstrual period. It includes several situations. First, congenital ovarian failure. Second, chromosomal abnormalities. Some patients are not purely female and lack proper ovaries. Some have congenital absence of the uterus, vagina, or imperforate hymen. Others have underdeveloped hypothalamus or pituitary glands. None of these cases will experience regular menstruation. The second category is secondary amenorrhea. After a history of normal menstruation, menstruation suddenly stops. Secondary amenorrhea has two situations. One is physiological amenorrhea. The other is pathological amenorrhea. Physiological amenorrhea refers to pregnancy or the use of certain drugs. For example, drugs like Delphin and linestrenol that suppress the hypothalamus. It is a physiological response to treat diseases and leads to secondary amenorrhea. Pathological amenorrhea includes premature ovarian failure, surgical removal or damage to the ovaries, damage caused by radiation therapy, chemotherapy, preventing menstruation. Amenorrhea is not a disease name, it is a clinical manifestation. Many diseases can lead to amenorrhea. Treatment must first determine the cause and classify it. Effective treatment can only be carried out afterward. Incomplete diagnosis leads to incomplete treatment. Unclear diagnosis leads to ineffective treatment. The main methods of diagnosing amenorrhea: combine medical history, chromosomes, hormone levels, panoramic 4D ultrasound. And if necessary, hysteroscopy, combined examination for confirmation. After confirmation, some conditions can be treated, known as relative infertility. If treatment is unsuccessful, it is considered absolute infertility. For example, chromosomal abnormalities like Turner syndrome with a missing X chromosome, 45X, or cases like 47XXXY, which cannot result in pregnancy as they do not produce normal eggs. It is impossible for those with congenital absence of the uterus or vagina to conceive. Hymenotresia is relatively treatable. Despite amenorrhea, we can open the hymen using minimally invasive techniques. Resuming regular menstruation and resolving amenorrhea. This type of amenorrhea is often accompanied by abdominal pain. Some secondary amenorrhea can be treated, while others cannot. For example, premature ovarian failure results in no eggs. Though ovarian transplantation or surrogacy is possible, the primary condition cannot be treated, assisted reproduction is the only option. In conclusion, amenorrhea is a serious clinical manifestation. It requires the expertise of a professional doctor and specialized techniques to identify the true cause and find appropriate treatments to achieve satisfactory clinical results. At Beijing Antai Hospital, we follow a contracted treatment approach. If the desired outcome is not achieved, a full refund is provided. During consultations, we must identify the true cause. If treatment is possible, we proceed with the contract. If not, we will never encourage you to take medication or pursue unrealistic treatments, avoiding unnecessary expenses. Commitment-based medical care is the gold standard for treating infertility.